Hi, it's Dr. Beddinghouse here, and we have another exciting live interview with Sue Boorn. Now, I've known Sue for many years, and she's a wonderful, caring, compassionate, classically trained homeopath. She went to the Homeopathy School International in Boulder, Colorado, as well as additional training through the Dynamis School for Advanced Homeopathic Studies. And she continues to go to many seminars and continue to learn and grow. She's also certified by the Council for Homeopathic Certification and registered with the Society of Homeopaths of North America. So let's welcome Sue.
Hi,
Hey, Sue.
Hi.
All right, this is going to be fun. All right, so I want everybody in the background to see that I have the book, the textbook of homeopathy by Dr. Samuel Hahnemann, and my little tiny statue of Dr. Hahnemann. Which way is it going to go? Okay, so we're good to go. All right, Sue, can tell us a little bit about how you got started in homeopathy? What attracted you?
Yeah, I actually first heard about homeopathy in the early 70s. But yeah, so I heard the name, and the way that I first learned about it was a very close friend of mine was using it at home for her infant daughter. Some of the issues she came up with her infant daughter, simple things like teething, colic, these kinds of things. And she said, oh, I love this. And it worked great. She said, I love this homeopathy. It's helping me so much. Now, I had never heard the term before, but it stuck with me because it was so unusual. And I thought, this is terrific. I didn't come across it again until the late 80s, actually, when I had a health issue of my own that I wanted to explore some other options. I had been to the doctor and they had explained what could be done, what the procedure would be. I had all my questions answered. And I thought, I don't know, maybe I'd like to check out some other possibilities. I know this option is here. So I called my friend and she said, I think a homeopath could help you. And I went to see a homeopath, and in 3 months I was good to go. Well, let me tell you, Dr. B, I was intrigued.
Yeah.
I'm sure you can relate, right? And then I took my children for care. So that was the late 80s, and I entered school some years later. I had a different business of my own, and then some years later, I decided I'm going to homeopathic school. I went straight to homeopathic school. I didn't go, I was like, do I need to do this or that? And then I realized, no, this is what I want to do.
That's how I got started in homeopathy too. I met a homeopath, and we had breakfast, and he was telling me all about homeopathy, and I could feel myself just getting closer and closer, and God, tell me more. Okay, so
Yeah.
I went to see him myself, and then I found the best homeopathic school I could and started my process also. But the thing that happened for me, I was having chronic fever blisters. God, I would have one a month.
Ooh.
And after taking the homeopathic remedy, I never had another one. It was phenomenal. Okay. So homeopathy is phenomenal. So tell us a little bit more about homeopathy. What is it?
Yeah, and I think that's really intriguing in itself. It was established actually in 1796, so it's a little bit over 200 years old. I think 225 years or so this year, by Samuel Hahnemann, who you mentioned, the statue behind you. So it's centuries old. Probably the major alternative healing modality out of Europe to come into the world. I certainly consider it an art and a science, both, because it has aspects of both, like I think all good forms of medicine have. It prompts the body to rebalance from the inside out by stimulating the natural processes that we have for getting well. And so this is the thing I love so much about it, is that it restores our balance and our health by using our immune system, by utilizing the endocrine system and the systems that we have to come back into balance.
I know that's the amazing thing about it, because the way the homeopathic remedies are made creates a safety like hardly anything else, okay, without side effects and stuff like that. So, what kind of patients do you see?
Oh, wow.
Practice?
Yeah, a really wide range. I mean, now I've been practicing 22 years, and so you do see a wider range. You feel comfortable seeing a wider range of people with different, issues as you practice more. But I would say everything from injuries, acute type things, injuries. I have a family right now who's got some viruses going on, so that acute type of thing as well, all the way through chronic, long-standing disease, even into situations where, let's say, there's a chronic disease that's very advanced stage, and you may or may not be able to do much to reverse that, but homeopathy can be incredibly helpful in palliating
Yeah.
end stage and make people much more in pain, less anxiety, much more peaceful, even at that stage.
Yeah, I recently, I forgot, maybe it was on Facebook, about homeopathy coming into the hospitals,
Yeah.
in ICU, because God, so many things are going on there. And if nothing else, homeopathy can create calm in a person so that they are then able to begin their healing process. So, as a matter of fact, remember, Denver had a homeopathic hospital back in the 1800s.
It did. It did. I've seen some black and white pictures from the Historical Society of that hospital. Yeah.
Yeah. And, one of the things that fascinates me is homeopathy is worldwide now, okay? A lot of European physicians and a lot of in India, homeopathy is big.
Yes.
And so one of our great teachers, Dr. Sankaran, is from Bombay, was he? No.
Yeah. Mumbai. Yeah.
Mumbai, yeah.
And
So,
his wife too, Divya Chabra.
yeah.
But so much homeopathy in India, Brazil, certainly Europe. But homeopathy now, there are schools in Japan, actually in Cuba, because they didn't have conventional medicine after the blockade. Homeopathy came in and became very strong, and it's used widely there, preventatively and so forth. Not that conventional medicine isn't there, but it really grew there.
Yeah. And okay, so this used to happen for me when I'd have when I was doing homeopathy primarily, is a patient would ask me, do I have to stop my prescription medications? Could you say a little bit about how homeopathy works?
Yeah, sure.
In spite of prescription meds.
I think it's a big question that's asked often, and I have a lot of clients who come who are on prescription meds, and this is, certainly needs to be addressed. So people do not need to go off their prescription meds. Number one, that's for the medical doctor to regulate, not for me to regulate.
Yeah.
Secondly, honestly, in order to get the best homeopathic information to find the best match for them, I need a baseline to know where they are. I want to know where they were before, what were the symptoms before. I want to know where they are on the med. And there are usually some little spikes, and that's what we use to see if the remedy's working. So once you get a good remedy to work, you continue to use that remedy for it to level out. Then, after a period of time, they can speak to their medical doctor about slowly what's the right way to begin to reduce those meds while the remedy is being used in concert with it.
Right. And that's another point with homeopathy. One dose of a remedy can last a long time.
It can.
Yeah, and you don't repeat it until you see maybe a decline in the symptoms and the body's asking for a little boost. Would you agree with that?
Generally, I would agree with that. However, as you know, Dr. B, there are some potencies in homeopathy that are really designed for the person who may need a very gentle dose on a
Yeah.
more regular basis. But in general, yes, exactly what you're saying, because that person's need may be more frequent and very gentle, especially if it's a long-standing chronic disease. But
Yeah.
yeah,
Okay, I forgot about the LM potencies. Yeah, sometimes they need to take it every day or once a week or whatever. So
yeah. But in general, yeah, a one dose can last amazingly long. I mean, it's mind blowing sometimes.
I know it is. It's shocking. I've had a few shocking cases. Do you have one in particular you'd like to share with us briefly about what happened?
Yeah, there's one that really. So it was some time ago, a long time ago. But this one I really like. It's it was a case of allergies actually, and so it wasn't this necessarily this deep chronic disease, except as we see now, there are so many people being affected seriously by allergies these days. And it becomes a chronic problem for a lot of people. For this man, it was. And that was because the thing he loved to do the most, which was ride motorcycles. And he loved to ride them out on the eastern plains in the tall grasses in the spring and summer.
Mm-hmm.
Kind of dirt, I think they call it dirt bike riding.
Yeah.
Well, over the years, you can imagine riding a motorcycle through fields and tall grasses, and he has allergies. I mean, he was miserable, just miserable. His eyes were watering, they were red, he was sneezing, he was stuffed up, all the classic symptoms of allergy. And it
Mm-hmm.
came to the point that he just could hardly even ride anymore. So he came to see me. I took all of his information, as we do, the specifics about the symptoms, but also the big picture about him. And I gave him one dose of remedy. I sent him home, gave him the remedy. I said, take one dose. Well, I didn't, and I asked him to be in touch with me, but I didn't hear from him. Didn't hear from him. I touched base with him, didn't hear from him several times. I thought, well, this happens sometimes. All of a sudden, he contacted me about, I don't know, several months later, near the end of the summer. And he said, I just wanted to tell you, I just ended my best summer riding ever because I had no problems. And I said, are you continuing to take the remedy? He said, no, I just took that one dose and they were gone the next day. That's what he told me.
I know. Let me share one quick. Several years ago, I had a patient come in and she had warts, plantar warts, all over her feet. I mean, it's the worst I'd ever seen. So I took her case. I gave her a remedy. She came back for follow-up, and nothing happened. I actually consulted with another homeopath. We agreed that it was a good remedy, what we call a simillimum, or the closest remedy to the core issue. And after a couple of more visits and doses, she comes in, sits down in the chair, and I'm just like, oh God, I hope I helped her. She takes her shoe off and shows me her foot that was completely clear. Okay, I was shocked. I couldn't believe it. Okay, this woman was totally covered. She was so ashamed of her warts that she would wear sandals. Okay, they covered the bottom of her feet, and of course, they're very painful. So, I mean, that is the one case that absolutely blew my mind. Okay, I haven't heard from her, and I'm pretty sure they've never come back. I did hear from her through her mother a few times, but it's amazing.
I know. And Dr. B, I think I'm sure you see this too. After years of being familiar with homeopathy, I still run across cases and situations that completely blow me away as to what it can do.
I
The
know.
depth of it and the speed of it. Not necessarily all of them go that way. Of course, some are slower, but it still amazes me.
I know, it's phenomenal. So homeopathy can be used for acute illnesses and injuries. It's great for injuries and bug bites and stuff like that, but also for chronic conditions. But tell us a little bit about working, like is it safe for pregnant women and babies?
It is because totally, I have no issues with that at all. Because the remedies are energetic, serial diluted, non-toxic, and I would say very importantly, that they should be given in most cases by a practitioner, someone who's properly trained, knows how to adhere to homeopathic principles, because those are very different than, we have our own set of principles of how to do this and how it should be done properly and how remedies should be administered and so forth. So as long as that is adhered to, the remedies are very, very safe. They're very gentle. One of the reasons that in most states they aren't required to be registered or licensed is because homeopathic remedies are seen as being very safe and non-toxic and not harmful. And
Yeah,
as long as they're used properly.
that's right. As long as they're used properly. Okay. Now, some people can have if they get some basic training in how to use them for acute things, they can have a home remedy kit, and they know, when to use arnica, when to use apis, and different kind of remedies that will help with acute situations. But seeing a well-trained classical homeopathy, and we use the word classical because that means we're following the principles of Dr. Hahnemann as laid out in that textbook, The Organon, which is an absolutely fantastic book. And a lot of people will say, "Oh, I went to a homeopath," but they're doing other things like using machines and things like that. That's not necessarily homeopathy. Would you agree with that?
I would say that very often you see things that a part of it may be homeopathic, but very often the application of it is not homeopathic. So yeah, I would definitely agree with you. And I think in order for it to be at its best, it does need to be through someone who's trained. I have no problem, as you're pointing out, with my clients having home kits and using it for, first aid type things, simple things. In fact, I want them to. And it's nice for them to have a kit. Sometimes when I'm even recommending a remedy, they may have it at home and it's easily accessible. That's great. But they also, my clients know when it's okay for them to give a remedy and when they need to get a hold of me.
Right. And, homeopathic remedies are at natural groceries. I think they have probably some at Whole Foods. And if there was a specific pharmacy that was more holistic, they may have some homeopathic remedies. But the best thing is to consult with your homeopath. And there are quite a few homeopaths in the area because of the Boulder School. So, okay, let's see. Now, you and I have had a few patients in common, and if I think a patient would benefit from homeopathy or they want it, I may refer them to you. So how do you work with a traditionally trained doctor who is the patient's doctor? I mean, maybe they didn't even refer to you, but if you feel like you need to communicate with them, how do you work with that?
Yeah, I am very open to working with any of my clients, caregivers, health caregivers. So whether the client brings, let's say some clients might bring their test results, or they might email their test results to me. Not that I'm using that to decide the remedy, but that can be important information that may be helpful to me. I often say when clients come to see me, if they have not had any diagnostic tests done, I may say, I'll be happy to take your case and we'll look for a remedy. And I think you should see your primary care physician and get some diagnostics and an assessment. Because, for instance, if they, example, let's say they have left-sided pain over here. Well, what is it? Is it ribs? Is it spleen? Is it what is the system or the organ or the where does the problem lie?
Right.
Again, it doesn't tell me the remedy. But if I'm looking at several remedies, it may be very helpful in telling me what one might have a stronger affinity for what they have.
Yeah.
I'm open to talking to their medical doctor, their functional medicine doctor. I'm always happy to talk to their chiropractor, and I have before in my years, not frequently, but yeah, let's be cooperative. I think there is plenty of room in the healthcare system for many modalities to cooperate with one another and be helpful to one another.
Yeah, absolutely. And one thing that I realize that you have to work through and with the belief system of a patient, okay? So if a patient doesn't believe in homeopathy, they're probably not likely to benefit from it, okay? Because they've got to have an understanding. If they don't believe in my approach in functional medicine, they're not going to, if I tell them to change their diet, they're not as likely to do that. So mindset is really important too.
It is. And at the same time, I would say in homeopathy anyway, I would totally agree with you in terms of the client understanding enough to realize what they need to do.
Yeah.
Will they stick with it? Will they listen to their provider and communicate well?
Yeah.
And at the same time, I think you know very well, homeopathic remedies work on babies, on animals, on people who don't even
Yeah,
know
that's true.
anything about homeopathy, and they don't want to know anything. They just want to get better.
Yeah, that is certainly true. It can cut across belief systems for certain. Okay, let's see. What else do we want to talk about? If somebody wants to work with you, how would they get in touch with you?
Well, they can through my website. They can send me an email.
Okay.
Through my website, they can get my phone number and call me.
Okay, I think Tom is going to put that in the comments. Okay.
Yeah, yeah. Those are the two best ways. Either request. There's a contact form, just standard on my website, to inquire about my services, or they can leave a voicemail on my phone. Either one.
Okay, so what else would you like to talk about the wonderful healing power of homeopathy?
Well, I think that a couple of things that occur to me. A lot of times people want to know, well, what do these remedies look like? I mean, how do I take them? Uh, and so I think as homeopaths, we don't give that much thought because we've been around them so long. And it's very simple. They're either in liquid drops or they're in small pellets that are dissolved under the tongue. And as as you said, Dr. B, they stimulate our system to begin to rebalance. So that's the way they're taken. I think the other thing that is always important for people to know is how important the relationship is between the practitioner and the client. And that's true in any modality. I would encourage anyone, find healthcare providers that you feel comfortable with, that you can talk about anything, that you trust them to be transparent with you and honest with you and care about your health. Not more than you do. You have to care more about your health than anyone. But in homeopathy, it's so important because of the really, and functional medicine too, I would imagine. It's so important because of the scope that you're talking to them about, the whole person approach, and the range of things you're talking about, you need somebody you're comfortable with to talk about all these things that many of them, your sleep, your dreams, what stresses you out. These aren't necessarily things we talk to just everyone about.
That is so true. I remember in all my homeopathic training, I was being told you have to get yourself out of the way so that the person can reveal what needs to be healed. And or in functional medicine, we say, what was the trigger? We use that word. What triggered this? Was it a fear? Was it an accident? Was it an infection? Whatever it was that caused the biological systems to get out of balance. So, I think homeopathy and functional medicine are like twins. They work so well together. And, even though I don't ultimately practice only homeopathy, I still have all my remedies, and I still occasionally will use one if it's clear to me, or else I'll call Sue. Sue, I have a patient for you. Anyway,
This is what I'm saying about room in the health playground, I would call it, for lots of different modalities to play a very effective role. I am not anti-conventional medicine at all.
Yeah.
I am so glad conventional medicine is there. They do things that no one else does, for sure, every single day. But we need, and at the same time, we need functional medicine, people like you, Dr. B, that people can get, this wide scope looking at, well, you tell me, but diet and nutrition and,
lifestyle. Yeah.
Right. And we look at those things too, but with a different lens through homeopathy, a little bit different. But I can see why you say, I think often people who come for homeopathy, if they're seeing a functional medicine doctor, it's a lovely blend.
Oh, yeah, absolutely. I always had a dream of having a holistic clinic that had a variety of different modalities that were very complementary that could be used at specific times and blended together. Still a dream of mine. Who knows? Dreams do come true eventually. All right. Well, Sue, I can't begin to thank you enough for being willing to take a few moments out of your busy day to join with us. And I don't see that anybody's made any comments. Sometimes people are shy. But if anything comes up, and we've put your website and your phone number there, so it'll also be in the recorded version. So maybe we should do this again over a different subject. Maybe we'll talk about infections. Now that we didn't touch COVID, but homeopathy can be very helpful with things like that too. So maybe we'll do it again. Okay.
That would be great. It's been a pleasure. Always great to see you. And I love talking about homeopathy because I love it and I love doing it.
I know. I do too. And I'm glad you're there for my patients who request it and need it. Okay?
Well, I appreciate it. Thank you so much.
Okay. All right. Bye.
Bye-bye.